I'm back with another topic, and that is CHALAZION. So in this video I'm trying to teach you or explain you everything in English. Hope you will like it. Okay, so let's get started. What is CHALAZION? CHALAZION is a chronic non-specific inflammatory granuloma of the meibomian gland. So CHALAZION is a chronic non-specific non-infective inflammation of the meibomian gland, and it is the commonest of all lead lump. That means in chalazion, a lead lump formation occurs in our eyelid. Okay, so among all the formation of lead lumps, means in all other diseases, it is the commonest of all lead lumps. Okay, so chalazion is also known as tarsal or meibomian cyst. Now come to the etiology. What are its etiology? So first is children and young adults. It mainly seen in children and young adults. And next is it is related with blepharitis. Okay, it is related with chronic conjunctiva, example trachoma, and it is related with diabetes mellitus in adults, and it is related with errors of refraction. That means if patient is having any refractive error in their eye, then maybe it is the reason why chalazion occurs. Okay, now let's see the pathogenesis. What is the pathogenesis of chalazion? So uh, chronic inflammation of gland by low virulence organism. So chronic inflammation of gland by a low virulence organism. Usually there occurs mild grade of infection of meibomian gland by the organism of low virulence. So it is saying, that's why it is saying chronic inflammation of gland by a low virulence organism. Okay, next is blockage of duct of meibomian gland. As a result, due to the chronic inflammation, as a result, meibomian gland's duct gets blocked. Okay, so next is accumulation of lipid secretion, and due to the blockage of meibomian gland, the result is accumulation of lipid secretion. So lipid secretion is accumulated there. Next is breakdown of lipid into component of oleic acid. Consequently, there occurs retention of sebum in the glands, causing its enlargement. As a result, mucosal irritation occurs and cellular infiltration with formation of giant cell happens. Okay, so as a result, mucosal irritation occurs and inflammation of blocked meibomian gland and surrounding tissues occurs. So after that, proliferation of fibroblast occurs and granuloma formation happens. So let's see the histology. What are its histology? So centrally, so this is our eye, and there is a lead lump here, which is known as chalazion. So let me draw a large eye. So this is our eye, this is our eyelid. So here I am drawing a lump. Okay, so centrally cheesy sebaceous material. Okay, so this is the lead lump. Okay, so histology is saying that in the lead lump there is in the central there is a cheesy, means cheese like sebaceous material accumulates, surrounded by granulation tissues, which is surrounded by granulation tissues having lymphocyte, which is having lymphocyte around it, and epithelioid cells and foreign body type giant cell, means which is surrounded by giant cells, and fine blood vessels. Okay, fine blood vessels is also there. Okay, whole thing is enclosed by fibrous capsule. So this whole lump is enclosed with a fibrous capsule. So this is the histology. Now let's see the symptoms. What are its symptoms? So first is painless nodular swelling of eyelid. So symptoms include painless swelling of eyelid, in which the increasing in size of the lump is the main presenting symptom here. Okay, next is drooping of eyelid. So mild heaviness may occur due to this lump on the upper eyelid, which may lead to felt which may lead to fall of this upper eyelid. So that is known as drooping of eyelid. In case of large or multiple chalazion, it may occur. Drooping of eyelid may occur. Next is blurred vision occasionally seen. Blurred vision may be seen in some patients, but it is occasionally. Now let's see the signs. What are the signs of the disease chalazion? Okay, a small pea-sized swelling away from the lid margin. Okay, so this is our eye and this is the lump. So this nodule is noted slightly away from the lid margin, which is which is firm means soft, too hard or non-tender, okay, on palpitation. Okay, no sign of inflammation, there is no signs of inflammation here. Okay, next is skin over the swelling is normal and free from it. uh, the skin surrounded by the skin which is surrounded by this lump is normal and free from it, means which is not attached from it. On next is on eversion, the tarsal conjunctiva underneath the nodule is velvety red or purple and slightly elevated. So reddish purple area where the chalazion usually points here. So this is the chalazion, and reddish purple area which is surrounded, which is where the chalazion usually points, is seen on the palpebral conjunctiva after the eversion of the eyelid. Next is regional lymph nodes are not involved. The regional lymph nodes are not involved in this chalazion. So let's see the treatment. How can we treat chalazion? So in case of small chalazion, hot fermentation. We advise patient to give hot fermentation. Okay, we advise patient to take steroid like antibiotic ointment with lead massage. This is our eye, and we suggest patient to massage the eyelid. Okay, uh, with the ointment which doctors prescribe them for a few days. Okay, interchalazion injection of depot steroid 0.1 to 0.2 ml may be useful, especially in chalazion in the near the lacrimal punctum. If the chalazion is near the lacrimal punctum, so the interchalazion injection is useful for it. So next is in moderate, the other treatment in moderate to large chalazion. So incision and throughout curative under local anesthesia is done as an OPD procedure. So this is the most conventional process. Okay, so it is done as in OPD procedure. Okay, so next is in marginal chalazion. It is done under local anesthesia. Press out the material with thumb and index finger. So let me show you how it is done. Okay, so if this is a chalazion, so what doctors do, they press out the material with thumb and index finger. So this index finger and this thumb is used to press out the material which is present inside the chalazion. Okay, electrocoagulation by passing 20 to 30 milliampere current for few seconds. Okay, electrocoagulation is also used by passing 20 to 30 milliampere current for few seconds to treat the marginal chalazion. Okay, and last is correction of refractive error, if any. If patient is having any refractive error like myopia, hypermetropia, astigmatism, then we advise patient to first correct them. Okay, so that's it for chalazion. Hope you understand everything, and if you have any doubt, then please write down in the comment section. Okay, thank you.